Public health experts are asking area emergency medicine providers to be on the lookout for any patients coming in with signs or symptoms of MERS. Already, one suspected case was referred to Mercy Health West Hospital in our area. Medical reporter Liz Bonis stopped by that hospital and picks up the story from there in today's Medical Edge.
We had a call from a primary care doctor about a patient who the health department had been in contact with, and they were a suspect of possibly coming into contact with someone who had the confirmed MERS virus, and so they had came in for testing.
A.J. Lawhorn happened to be the nurse on duty when this patient came into the emergency room recently. MERS, which is a virus that looks like this, stands for Middle East Respiratory Syndrome, according to the Centers for Disease Control.
It causes a severe respiratory infection, which leads to basically a viral pneumonia, and in about a third of cases has led to death.
Dr. Larry Holditch and Dr. Steve Englander are part of the public health team assigned to keep MERS as it arrives in the U.S. from spreading. That's one of the reasons emergency rooms are notified of suspected cases. There have been 3 confirmed cases so far in the United States.
Actually, since around October, individuals with severe respiratory illness in the U.S. have been tested for MERS.
So the question quite often comes up, are we better at tracking illnesses, or are there more of them that are kind of making their way to our country?
I think that that's a chicken and egg kind of question. We're certainly getting better at finding them, and we're certainly finding them with some regularity.
As for the patient Nurse Lawhorn saw, she reminded them,
having some extra questions in your back pocket is helpful. So I think we've been asking some more questions that we don't routinely ask of patients.
As with any other illness, then, there are certain precautions they do need to take anytime a patient comes in with something that might be airborne or infectious to others. But they say it's not a whole lot different than many of the other things they have to do every day to stay safe in the emergency department.
We have standard precautions that we deal with everybody.
Those standard precautions are often as basic as hand washing, but Dr. Meyer says most emergency rooms, including his, also have an additional high-tech weapon now. It is called the negative pressure room.
It allows, when you open the door, for the air to move from the hallway into the room as opposed to vice versa, so that you don't have an infected patient in a room spreading germs that are then getting sucked out into the hallway around the other patients.
The good news, the patient Nurse Lawhorn saw tested negative. She has now been discharged and is back on the mend. At Mercy Health West Hospital in Western Hills, Liz Bonis, Local 12 News.
Now, those 3 cases in the U.S. have been reported in Indiana, Illinois, and a healthcare worker in Florida. 2 had to be hospitalized. 1 required no treatment. All have since recovered.